Well, thanks so much for watching Making Healthcare Work for You, Different Perspectives and Empowering Solutions. I'm Stephanie Fields, joined by my co-host, Dr. Apoorv Gupta, and today we're welcomed by Dr. David Nash, who is the founding Dean Emeritus and Grandon Professor of Health Policy at Jefferson College of Population Health, as well as the author of How COVID Crashed the System. Thanks so much for being here.
Great to be together. Thanks for having me.
We loved the interview. And now for our one question, maybe one question each, not sure yet. I'm tossing to Apoorv. Take it away.
Thank you, David. Again, just a personal thrill to have you here. I can't believe that we have you on. Dr. David Nash, the founding father of population health, speaking to us in our so-called virtual studio. So thank you personally for accepting our invitation.
You're welcome.
You know, what I was thinking about, David, is we talked a lot about in the interview about the systems that crashed, public health, potentially even population health system that's still being built. Maybe that hasn't crashed, but hasn't yet gotten off the ground. I don't know what the analogy is there. But you talked, you opened our eyes a little bit in terms of thinking about we're not going to get to value-based care, I should say, without, focus on health equity. And the follow-on that I wanted to ask you about that is, what about the values-based care idea? We certainly know that there's structural things we have to do, systematic, tactical things that we have to do, evidence-based medicine and the like, and certainly having to focus on equity. But how about the way in which we treat each other? Love and passion, respect, kindness. I'd love your thoughts on what role that needs to play in the system that we're trying to build towards.
Wow. Yeah. Wow. Well, the world could certainly use a little love right now. That's for sure. Well, I didn't invent it, but certainly we've got a great history on that question, because if you go back to people like Deming and Donabedian, right? So the great grandfather and the grandfather of quality improvement. So, Deming and even more Avitas Donabedian, when he was still alive and working at University of Michigan for 50 years, he said quality is all about love, So there's a history here. And I guess in the modern era, I would give Tom Lee at Harvard a shout out, because he's all about, love and values are critical. It's a tough question. We live in a super politicized world right now. The world is facing two wars, anti-Semitism, Islamophobia. I mean, it's hard for me to see my way past some of this right now. Organizations who value their employees, I think they're the ones who will come out ahead in this arena. Because if people feel that they have value and they have meaningful work to do, and that their views are listened to, they will deliver, and there's research evidence to prove it. They'll deliver safer, higher quality, better outcomes, more efficient care. So, is love connected to a better outcome? You bet it is. Nash didn't invent this. We've been talking about it for 60 years. Making it work is a leadership challenge, no question about it. But I think at the end of the day, if people feel valued, they're going to deliver value. That's the golden rule in many ways. It's a great question.
Is that something that you've personally felt that has been important to you when you've been dealing with your own patients to try to make them feel that love and compassion, and that you felt when you were a patient?
Yeah. I mean, could I have done a better job, delivering that? You bet. I mean, I trained a long time ago. So, you want to get real. I never asked a patient, do you have food in your refrigerator? I never once asked a patient, did you have trouble getting to the office today? Not once. I mean, wasn't trained to ever ask that. And frankly, I mean, we didn't care. I mean, with all due respect. So that's a big, that's a mea culpa, right? So my doctor daughter, she got trained to ask these questions. You know, it's a totally different world. She's going to fill it out on the computer, you know. So there's hope for the future. Being a patient and being a recipient of care at the bedside by nurses, especially, who I knew they felt that their work was valued because they delivered it in a compassionate way. And that's really crucial. So, you know, it's like everything else. It reminds me of the book Zen and the Art of Motorcycle Maintenance. You got to be of a certain age, right? 1977. Here's how it goes. Give away what you want most, right? You know, you want to be loved? Give love. You want autonomy? You know, then be transparent in your outcomes. You know, so that's the secret. And what a great book. So I would recommend people read, you know, the Zen of motorcycle maintenance. A crazy title, but the theme, you know, 50 years ago is still true today.
And of course, add how COVID crashed the system to that list.
You bet. And of course, how COVID crashed the system. Right.
We're so thankful that you were here and shared this. It was an amazing story. We really appreciate your time.
Well, thanks again. Wonderful.
So grateful. Thank you.
And thank you all for watching. We'll talk to you soon. Bye-bye.